Good afternoon and welcome to today's COVID-19 update. I'm Heather Fairbairn. I'll be your moderator today. Before we begin, allow me to introduce the Honourable Iain Rankin, Premier of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Take it away, Premier.
Thank you, Heather. So today we are reporting 121 cases today into the system, again, mostly in the HRM area. That number is still high, but obviously it's starting to look a bit better. We continue to work through the backlog in our system and have cleared most cases sitting in the queue this weekend. We're catching up, and I want to thank those that have been working around the clock to ensure that we do that catch-up work at Public Health. And I want to thank all Nova Scotians for your cooperation and your patience and your good compliance with the regulations as of late this weekend. I noticed it was relatively quiet. I didn't see crowds around when I went out for my testing, and I didn't hear of any fines. I checked this morning, there was 2 fines officially over the weekend, which is a lot less than the 37 that we had weeks ago. So obviously the message has been heard, and Dr. Strang and I certainly appreciate that work that you're doing. I know it's difficult. This shutdown will work, and there are early signs already with our cases starting to come down that it is working. Little to no exposure sites, and the cases are coming down. The testing we're doing continues, and I saw it myself. Like I said, I went on the weekend to the Canada Game Centre. There was a lot of Nova Scotians going out to get their regular testing. I want to thank the thousands of volunteers and other organizations that have partnered with us, especially Dr. Lisa Barrett for mobilizing Nova Scotians to continue to do their testing. And this is truly a Nova Scotian initiative that's getting national recognition with 3 times the amount of testing that we're doing, more than the national average. I do want to send my regards out to those families that did lose loved ones to COVID. I know this continues to be a difficult time, and those that are in the hospital, we now have 58 in hospital, 9 in ICU. So our thoughts are with those families and those that are suffering from this disease. We wish you a full recovery, and our thoughts are with you. I wanted to make a clarification on a policy that we made just on Friday as we tightened up our border. I know a lot of people want to continue to come to our great province, and frankly, we don't blame them. We want people to come here to stay and work and play, but this is a difficult situation now that our border is closed. Obviously, there are exceptional circumstances. You sold your house in another province and took ownership on a house here in Nova Scotia all before the border closed, or you've signed a lease. We recognize there needs to be some flexibility around previously agreed upon dates, and we don't want you to be homeless, quite frankly. So we've opened a compassionate exemption application to help process these very specific cases. For people who don't close on their home until the end of May or June 1st, you're still fine. We're just asking those that are currently buying homes or renting apartments to please push your closing dates out to June 1st. We want you to come to our province. We're just asking you to delay your move until we can stop the spread of the virus. And finally, many people I know aren't working. We're now close to 2 weeks into this shutdown, and we have restrictions in place that are limiting hours of work for people. That's going to continue for days ahead of time. So what we're going to do today is we're going to invest $1.3 million out to a number of organizations, primarily Feed Nova Scotia, who's representative of about 140 food banks across the province. That money will go out immediately out to ensure that we deal with the food insecurity that's present in communities. And then the remainder will go to family resource centers and smaller local food banks that aren't necessarily affiliated with Feed Nova Scotia. So hopefully this investment helps with Nova Scotians that are challenged to find food, and you can call 211 for assistance. Now I'll turn it over to Dr. Strang.
Thank you, Premier, and good afternoon, everybody. I hope everyone did have a nice weekend, especially all the mothers and people in mothering roles out there across Nova Scotia. And I want to thank everyone for celebrating Mother's Day differently again this year, whether it was virtually or from 6 feet away. I also want to thank everyone for staying close to home. I've heard stores were much less busy, and I'm hoping people heeded our advice to shop only for essentials. My comments about the sandals certainly went down an interesting path from what I've seen on social media. But as I said on Friday, this is not the time to shop for non-essential items. Shop online and do curbside pickup or delivery when and where you can. And always, if possible, buy local. Your support will help until we can open things up again. We have been making steady progress in addressing the case backlog in public health, and we're close to being caught up. Many of the backlog cases were reported in our numbers over the last few days, and some may continue to show up for a day or two. But by midweek, I expect the backlog will be cleared and we will be back to our usual process. I want to remind you that we announced the change to our testing and isolation protocols on Friday. Anyone who has been or needs to be tested because of a potential exposure, because of symptoms, or because they believe that they were in close contact with somebody with COVID, must self-isolate until they receive their first negative test results. And if you feel sick, assume that you have COVID-19 and isolate right away and arrange for testing in a safe manner. And the rest of your household, in these situations, your household must also isolate until you get the person who's feeling unwell gets a negative test result. This is new, but given how, the household having to isolate with the people waiting for the test result. But given how easily the variant can spread, everyone in the household should assume they have also been exposed, and we want to make sure that you're not out and about until we get that first negative test result. So we need your help. We need you to take action. Don't wait to hear from public health. But if you're in any of these situations, isolate right away and arrange a testing where possible. If you know you are exposed and you think you're at risk, go book a test at a primary assessment center or one of the pop-ups and isolate. We've resolved some of our testing capacity, so we're now back where we can also do a volume of the asymptomatic testing through our PACs with PCR. So for asymptomatic testing, you can once again make a choice between a PAC or going to one of the pop-ups. And if public health tells you are a close contact of a confirmed case, or if you were at a high-risk exposure location, just a reminder, in these circumstances, you will have to self-isolate for the full 14 days, no matter what your initial test results show. On Friday, we announced we were closing our border to anyone who wanted to move here during the month of May, and we asked people to wait. These measures came into effect today and are creating some hardships. We did not intend for anyone to find themselves without a place to live. So we will now use our compassionate exceptions process to consider cases that have extraordinary circumstances. And we will make sure that all the information on this is on our website today. I know these border measures will be difficult no matter what. People have made plans, and those plans are now being significantly disrupted. But we are also necessarily disrupting the lives of all Nova Scotians with our restrictions. Our current situation means we need to do whatever we can to protect Nova Scotia. I hope those who had planned to come will understand, and I hope you will continue to make your way here when things improve and we reopen our borders. These are challenging times, and some of us are struggling more than others. While these restrictions are in place to protect our physical health, we know that they are affecting our mental, emotional, and financial health. Everything about this situation is hard, and it's okay to not be okay. It's hard for people who look forward to going to the gym, meeting friends for coffee, and going to work. Sometimes we don't realize the impact of these daily activities until we have to stop them. It's hard on business owners. They are doing the right things to protect themselves, their employees, and their customers, but it's taking a toll on their operations and their livelihoods. It's hard on parents who are trying to keep working full-time while overseeing their children's online learning. And it's hard on children who are being asked to sacrifice the things they love and miss out on sports and times with friends. And it's hard on our frontline workers and volunteers in our healthcare facilities, grocery stores, and community organizations who continue to provide support for those who need it. It's hard on people who are caring for loved ones who are sick because of this virus, not to mention those who are grieving loved ones who have died. We need to talk about these struggles. We need to create a safe space for people who are struggling. Nova Scotia Strong, it's a hashtag, a slogan on bumper stickers, coffee mugs, signs on our windows at home. Being strong also means having the courage to admit we're not okay, that we need a hand and we may need support. If you or someone you know is struggling and looking for support, we have information on the COVID website, or you can call 1-855-922-1122 for mental health and addiction support. We can stay strong, but we need to do it together. Check in on one another virtually and ask for help when you need it. Show the compassion, empathy, and heart that Nova Scotians are known for around the world. Please take care of yourselves and each other.
We'll now take questions from media on the phones. We'll do one question and one follow-up, starting with CBC's Jean Laroche. Go ahead, Jean.
Good afternoon, gentlemen. I just wondered what went through your heads when you heard about the church service that went on in the Valley this weekend, and we had 26 people being fined. Premier, your thoughts, and then Dr. Strang, please.
Well, if that's indeed accurate, then I would be very disappointed for any gathering that's happening when we've asked people to stay home, and you know, we're trying to get through this third wave, and I think that most Nova Scotians are listening. I don't have details of this circumstance that you're speaking to.
And for me, Jean, it's disappointment. I have a strong relationship with a whole range of faith leaders. I have regular connections with them, and they all understand the need for them that we all together we recognize the importance of faith services, of worship, but also recognize that there are other right now there's a need to do that in ways that don't bring people together, and the vast majority of our faith leaders understand and support that. So, but it's disappointing that this happened, and I hope people understand that we're not doing this just because we want to, but it's absolutely necessary to keep each other safe. And even these congregations, they're putting each other at risk by coming together in person.
Go ahead with your follow-up, Jean.
My follow-up's for Dr. Strang. If I understand you correctly, the cases we are seeing, or the numbers we are seeing today, reflect the time after the restrictions were put in place by the province 2 weeks ago. 121 cases. What does that tell you about the way out of this wave?
So we're still dealing with some of the backlog, and some of that backlog may well be people who their exposure happened prior to putting on the restrictions. We're still a couple of days out from 2 weeks on that, but we are still certainly seeing new cases coming in. But that number of new cases, that trend over the last week is coming down on a slow but regular basis. What it means to me is that we are headed in the right direction, but I'm fully aware that you don't turn this around overnight, and so we have a number of weeks, as we said on Friday, the month of May, that we all have to stay committed and with the restrictions in place and everybody following those before we can start to bring the case numbers down to the very low level that we had in March and April. And then when we're at that position, like we learned in last June, that our process will be a slow, gradual opening of restrictions. We know that other jurisdictions have made the mistake of opening up too much too fast, and how that sets them back. So learning from the past, but also recognizing where we're at, and not taking things out of what am I trying to say? Not taking things acting too early, knowing that we have to be slow and cautious through this whole process.
Moving on, we'll go to CTV and Natasha Pace.
Thank you. Dr. Strang, I just wanted to be clear. Could you explain exactly what the backlog is at this point? From my understanding, talking to Dr. Hatchett, the lab is now all caught up in processing tests within 24 to 48 hours. But we are still hearing of people who 5-6 days after getting their first COVID test have still not heard from public health. So where exactly is the backlog?
So the backlog's in public health, almost resolved. As I explained on Friday, the process goes, somebody goes for a test, their swab then goes to the lab. The lab processes it. We had thousands and thousands of those, which created a backlog and were resolved through the lab. Of the thousands of tests, there were hundreds of positives, which then went over to public health. Each positive that comes in, public health assigns that to a case investigator who starts the follow-up. They enter all their information into our information system, Panorama, and from that, the epidemiologists extract the case information and create, our epi report every day. That's the process. So that bulge that went through the lab, and then the smaller but still big bulge that went over to public health, it's taken us a number of days. We only have so much capacity, so many cases per day that public health can start new investigations on. But we're almost through that. So again, in the next day or two, we'll be back to regular processes where it flows through in a much more timely manner from into the lab, out of the lab, over to public health, and public health then initiating a quick beginning of an investigation.
Go ahead with your follow-up, Natasha.
Thank you. Do you have any idea, or can you give us, I guess, an estimate of how many people in this province are actually isolating right now because of COVID?
A few days ago, we were up on, I think it was about 8,000. I don't have a current number today. We're probably still in that range, if not a bit more, because we've had many people isolate, then they're isolating for 14 days, and we've added a number of cases since then. So we're in the many thousands of people, I'm sure, that are isolating because of COVID.
Next, we'll go to Global and Alexa McLean. Go ahead, Lex.
Thank you, Heather. Good afternoon. Premier Rankin, I'm hearing of widespread concerns from the childcare sector in our province. Early childhood educators are unifying their voice. They had a meeting last night, and they say that your government's failing them on two particular fronts. The first is a lack of transparency over case numbers. Any case numbers in schools are publicly reported, and they say that they're told that because of confidentiality, child care centers, those case numbers aren't being publicly reported. They want those case numbers to be publicly reported. The next one is about rapid tests. They say that they have a dire need for rapid tests at child care centers. My understanding is there's about 600,000 rapid tests in stockpile, and early childhood educators want to know when they can expect those rapid tests at their care center doors.
Okay, well, I'll start. Yeah, so we're testing, like I said, 3 times the national average in Nova Scotia. We continue to make tests available widely. We understand that our early childhood educators are our front line right now in this pandemic. They've had to stay open like they have across the country in these waves that we're dealing with to ensure that our essential service workers have access to childcare, and we want to thank them for that. Those families that have been impacted, the centers, as soon as there's cases, those families that have their children in the child care center are notified immediately. So I think that that's an important step that we take, and we continue to make sure that we have safe environments. We've made modifications in this wave to make sure that happens. We've decreased the capacity. My understanding is that they're 50% or below. So we continue to make sure that we're valuing the work and doing the safe protocol that we can do.
Yeah, I'll add to that. So, people are notified when there's as the Premier said, when there's a case in a child care center. And again, just like we had in schools, just because there's a case in a child care center doesn't mean there was that there's been a transmission of the virus in that child care center. The majority of cases we've had are isolated cases from the community that happen to be attending or working in a child care center. But the appropriate people are notified in every single circumstance. If we do have an outbreak, and we have a few of them, then and we've got a couple of daycares that we do actually close down the appropriate response. In terms of access to testing, when you have cases and contacts, the rapid testing is actually not the test we need. We need people to get PCR. So we support child cares with testing, and if necessary, we would bring testing to a child care center, but we haven't had to do that. The numbers in any one child care center are generally low, and we use our existing testing as facilities and strategies to get people tested. We are working, decreasing capacity. We're also working to make sure that that child care centers are supported with the appropriate necessary supplies of PPE for a child care setting.
Do you have a follow-up, Lex?
Yeah, I do. they say that, they're being given shields, but what they need are rapid tests. But on another note, I'm hearing that nurses are being asked to float on short notice to COVID-positive units. And some of these nurses who are being asked to float to these units have not had their first dose of a vaccine. So that is obviously putting a lot of strain on them. Can you unpack that a little bit? A, is it true? And B, why is this happening?
So we've had from January, we've had lots of opportunities for healthcare workers to be immunized. When we got to the end of the healthcare worker stream, there was at least on 2 occasions that healthcare workers were reminded of their opportunity to get vaccinated. We still have some healthcare workers who, despite those, did not get immunized. And we also may have some new people. We're certainly aware of that there may be a small number of people, for whatever reason, haven't yet had their first dose of vaccine, and we have identified that. The health authority and their occupational health are working to make sure that people who have not yet had a dose of vaccine, with a priority being those who are asked to work on the COVID unit, are getting vaccinated as quickly as possible.
Moving on, we'll go to the Canadian Press. Keith Doucette. Go ahead, Keith.
Afternoon. Dr. Strang, I wonder if you can give us an update on the uptake of vaccines since we've opened it up to a couple of more age groups, and especially with the AstraZeneca. Are we seeing the uptake we need to see in order to meet the targets of the number of people that we want to get vaccinated?
We're still seeing a very high uptake. We opened up to on Friday on the 45 to 49-year-olds. We've had a huge uptake, and a high number of, or high percentage of the age cohort in that 5-year age cohort. We matched it up with a number of appointments that are already booked, and so soon we're looking at opening up to the 40 to 44-year-olds. So we're still having very high uptake for our vaccines as we move down the age cohort. We of the 60,000 doses of AstraZeneca that we have had in the province, over 55,000 of those have been administered into arms, and we still have demand for the small remaining numbers of AstraZeneca that we have left.
Go ahead with your follow-up, Keith.
So at this point, are you confident, based on what you're seeing in terms of the numbers, that we will reach that 70% target that we've set for ourselves, or do we still need the public to get it in their heads that they have to get out and get a vaccine if that's what they want to do?
Well, ultimately, it's always all about the public. We're not mandating this, but we're making it available, very available for Nova Scotians. So far, when you look at you look at the age cohort who've had a sufficient time to have access to vaccine, and we have a reliable number of what the vaccine uptake is for those age cohorts. We're starting 65 and above. We're over 80% in each of those age cohorts at this point in time. So it's critically important, though, that we continue to have that high uptake of vaccine as we go down to the younger age cohorts who are historically, perhaps less likely to get vaccinated. But they're the ones that now are having a lot of more of the burden of the variant strain. So hopefully that shows them that how important it is for them to get vaccinated. Everybody who's eligible for vaccine needs to come out and get vaccinated. We have lots of vaccine coming in the next few weeks, lots of access across the province. There's no reason not to come out and get vaccinated.
Moving on, we'll go to the Chronicle Herald. Nabal Snan. Go ahead, Nabal.
Thank you. Good afternoon. Dr. Strang, we've been hearing complaints about a charity going door to door to raise money during the past few days. Does the province have any policies around door-to-door fundraising or canvassing, or is it something that you're looking into?
We don't. We certainly, would say that door-to-door needs to be done carefully. We have lots of door-to-door deliveries, and we ask that people, when they're accepting a delivery or somebody comes to their door, that you make sure that you have a mask on when you open your door. That person that you open to should be back 6 feet away. But many people are not wanting unknown people coming knocking at their door, but we don't have any restrictions against that.
Go ahead with your follow-up, Nabal.
Thank you. Premier Rankin said that we're close to clearing up the the data entry backlog that we have. I was wondering if Premier or Dr. Strang, you can give us an estimate into how many cases are left in that backlog.
So that's very fluid. It's certainly come down significantly over the last few days, but you know, I've used the analogy of a bucket. So we had a big bucket of cases that public health has every day pulled from the bottom, the first in, first out, and the bucket is, the level of water in the bucket is coming down, but there's always new cases coming in, bringing the level back up. But we're pulling a lot more out than is new ones coming in. So the overall, at the end of each day, it's lower than it was the day before. And I expect within the next day that we will no longer have that bucket. Cases in will be assigned and they go out for investigation with no delay.
Next, we'll go to All Nova Scotia's Lindsay Armstrong. Go ahead, Lindsay.
Thank you. I'd like to follow on my colleague's question about that backlog. Dr. Strang, I'm hoping you can clarify the numbers. Given that this backlog is expected to be cleared up in the next few days, I'm wondering how this backlog affects the actual new case numbers that are reported. Are the numbers that we're getting from the province the actual positive cases that have been identified that day? And I'd like to know that the specific 200 additional cases you mentioned Friday, were those reported over the weekend?
So now the 200, we talked about 200 plus on Friday. We talked about that was the backlog. We're down to a point now that we're well below 100 with our backlog. The number of positive cases we're reporting are the ones that through that backlog, and you got to remember that backlog built up over time, that there were ones that as we come back to the bucket, as we pull them out of the bucket, they get assigned and they're entered into the panorama. And as they're investigated, each of those cases gets confirmed, and then that's the number at 6:30 every morning is our cutoff. We pull how many positive cases were investigated and entered into panorama over the last 24 hours, and that's the number of reportable cases we give every day. Once we clear up the backlog, then we know that the cases coming in or the cases that we report are the cases that came in the last 24 to 48 hours.
Go ahead with your follow-up, Lindsay.
Thank you for that explanation. That makes a little bit more sense. Given this lag and sort of the process that's involved in getting these cases to the point where they're reported publicly, I'm wondering how confidently you can say that our numbers are actually trending downwards. Do you have a clear sense that our cases are actually going down, given that the numbers may be a bit higher just with this backlog?
Yeah, we're seeing we look at a number of things, a number of, positives coming through the lab. We're also seeing, things, we look at our cases, the average number of contacts per case is coming down substantively, which means that for every case, that's a good indicator that actually people are following the restrictions and having far fewer contacts when they might have been infectious. And that's a very important indicator that says how many new cases may result from one case. But all the early indicators are that things are trending in the right direction. But we have to get through this backlog and then start to see the real-time case number. We fully expect that by middle of the week we'll start to get that number, and then I expect we will start to see that slowly trend down over the next number of days. But again, to get this to the point where we need to have it, you remember the days in March when we had 0, 1, 2, 3 cases? We need to get back there before we can start to be reopening, and that's going to take several weeks.
Next, we'll go to Radio Canada's Adrian Blanc. Go ahead, Adrian.
Good afternoon. Could you clarify what happens for Nova Scotian companies that have hired somebody from out of province with a signed contract, and that for compliance or essential reasons need their new hire to be in the province?
So this is where we have an exception process. We're asking these people, if possible, to make some arrangements between employer and employee to be able to push that out and not have the person come until at least until we get into June. But if it's necessary and essential, then we have the exception process that people can make an application to.
Adrian, do you have a follow-up?
Yes. When will the application form to be allowed to enter the province be ready? And in the meantime, what do you advise people to do if they want to make sure they will be allowed in?
So we have an exception process. It's available now. Is it all the information on that? It's been in the exception process has been in for other reasons. We've had that for months. So what we're saying is for these travel-related reasons now, for exceptional circumstances, people can submit their rationale to that email. All that information has been put up right now on our website.
Next, we'll go to Halifax Examiner, Timothy Bousquet. Tim, go ahead.
Hi, good afternoon. Dr. Strang, recognizing that there's been privacy issues and you couldn't give these sort of details before, but unfortunately the numbers have been much larger, so I think those issues are not so much at play. Can you, of the people who are in ICUs, the people in hospital, the people who have died, can you give us an indication of what the vaccination status has been with those people?
So I don't have a breakdown of all the cases. What I do know is that we've had certainly some cases, and I don't know whether any of them are in hospital or not. We do know we've had some cases of people who were vaccinated. Virtually all of them are people who became ill with a short period of time after getting vaccinated, which means they were exposed either before they got vaccinated or shortly after getting vaccinated. People have to remember it takes 2 weeks in healthy people to get a full immune response, and especially if people are elderly or have underlying health conditions, it may take up to 3 weeks to get the maximum immune response. So so if you're exposed to COVID shortly after getting vaccinated, it's not surprising at all that some people still get sick. We also know the vaccines aren't 100%, so there may even be people who have had 2 doses of vaccine who still get a COVID infection. But what we do know is that for them, their disease is in all likelihood going to be mild, and that they're going to be much less infectious and much less able to pass the virus on to other people.
Go ahead with your follow-up, Tim.
Yes, on the vaccination issue, the province is making progress and getting more doses out there. It's difficult, however, to look at the daily figures. Over the last 3 days, we've averaged just about 3,000 each a day, and we're seeing wide open, non-booked appointment times on the website, and pharmacists are saying that, hey, people aren't they're putting out Facebook messages saying sign up for these because they're open. Doesn't that all just lead to the conclusion that since older people have been vaccinated, it should just be opened up for more age range, maybe every age group now?
So we know because you have to. We don't have a certain amount of vaccine. We do in 2-week blocks. We know how much vaccine is coming out in the next 2 weeks, and we book exactly the number of appointments. Open up the number of appointments for that amount of vaccine. We don't want to overpromise. And we open up. Every week, twice a day, actually, people are looking at where we're at in terms of our appointments, and we're adjusting things. And so Friday, we opened up to the 45 to 49-year-olds, expecting that we were going to get to the next group, the 40 to 44-year-olds, maybe a week or 2 weeks in the next week to 2 weeks. When we've looked at the number of appointments already filled up in the 45 to 49-year-olds, we're probably in the next few days going to be able to open up to that 40 to 44-year-old. So when we have availability, we will open up, but we always do it in a very staged manner to make sure that we can deliver on the appointments, that when people book appointments, there's actually, when they go to their appointment, we can guarantee that they're going to have vaccine available to them.
Moving on, we'll go to the Globe and Mail and Marika Walsh. Go ahead, Marika.
Hi there. Thanks so much for taking my question. My focus, Dr. Strang, is on the AstraZeneca vaccine. I'm wondering if Nova Scotia will stop using the vaccine entirely and stop administering it for first doses going forward.
So as I said in my previous answer, we have only a very small amount of that vaccine available. It's still available for people 40 and above if they choose to, if that's their choice. We have no certainty at all about any additional AstraZeneca vaccine at this point in time.
Go ahead with your follow-up, Marika.
Thank you. We do, though. We know that more than 500,000 doses are coming in through COVAX in the next few weeks. And we know that 1 million are coming in June. So again, the question is whether you believe that given the safety concerns around AstraZeneca, we should stop using it entirely, given that we have so much mRNA vaccines from Pfizer and Moderna coming in.
So none of that vaccine has been being confirmed as being delivered for the provinces and territories. Until we get an actual confirmation from the National Operations Center about a vaccine supply, we won't take any action. We've had lots of fluctuation. So once we get confirmation of there is available of AstraZeneca vaccine, we'll have the discussion about making that decision. But we have absolutely no confirmation at this point in time that we will be receiving any additional AstraZeneca.
I can just add to that. I think the strength of our system really here, which I fully support, what Public Health put together is that central booking system, and we do have to have guaranteed supply before we get the vaccines out. So we're going at a fast pace through our age cohorts, but that's I think a distinction from other provinces who had to cancel, as you probably know, Marika, thousands of vaccines. We've had people show up to clinics where they had to cancel these clinics that they had vaccines just sporadically open up. So that's been our approach, and I think it's been one that's consistent, and we're really moving fast.
Next, we'll go to the coast with Victoria Walton. Go ahead, Victoria.
Thank you. Dr. Strang, sorry to keep pressing about the backlog, but you did mention that now we're opening up PCR tests at the primary centers now for everyone again. How are we going to prevent another backlog from happening in either of the places that had happened before?
So we're going to monitor very carefully our case number and also monitor the number of tests that are being taken and keep a very close eye on not overwhelming the lab.
Go ahead with your follow-up, Victoria.
Thanks. And Dr. Strang, I'm also wondering about ICU capacity. You said today that there's 9 people in ICU and lots in hospital. What is our ICU capacity right now? How many ventilators? Can you say whether anyone is on a ventilator?
Well, if you're in an ICU, there's a pretty good chance that you're in there because with COVID, you need breathing support and are on a ventilator. You'd have to ask the NSH and the IWK about the specific number of ventilator beds that they would have. Certainly, I know that in the last couple of weeks that we've ramped down a lot of other healthcare services to make sure that we can deploy beds and staff in the expected number or the number of people requiring hospitalization in ICU based on their modeling, based on our case numbers. Everything is pointing to we'll have more people, but everything is looking like we will be able to manage hospitalizations in ICU within the capacity that's developed. But that does, as I said, that does require ramping down lots of other health services.
And that's all the time we have for questions today. Back to you, Premier.
Thank you. We've just come through a tough weekend of being locked down and not able to visit loved ones, especially with Mother's Day. But you did it. So thanks for coordinating your visits through virtual and giving your mother a call. I'm sure she appreciated that. And Dr. Strang and I are so grateful for your cooperation and support as we work hard to reduce these numbers. By all accounts, it was a quiet weekend and the majority followed restrictions. I know it isn't easy to stay within your community and not travel around the province, but limiting your movement is helping us to reduce the spread within HRM and keeping spread outside across the province. Our numbers are just starting to trend in the right direction, but we're not there yet, and that's why we need to remain strong and work together. We do not want to seem unwelcoming. It is a wonderful gift when people want to come to move to our province. It's good for our economy, and it is good for all of us. Please don't use disparaging remarks when you see people out with different license plates. You don't know the circumstances of when they've come here, and we want people to continue to see us as welcoming people. We will ensure a level of flexibility on specific cases, but if I'm asking Nova Scotians to lock down, then I need to remain to keep our strong border protection intact. We didn't shut the border down in previous waves, but circumstances changed, and Dr. Strang and I needed to act quickly to contain the spread. Thank you for your patience, and thank you for making testing part of your routines. Please continue to follow the restrictions. They are tough, but necessary. I understand it is hard, and everyone is tired. but we are asking you to hang in for a few more weeks while we continue to ramp up the vaccines. You're all doing great, so keep up the great work.